All right, jumping right in. We're doing a deep dive today on something that's unfortunately a reality for a lot of people, especially as we get older, dealing with hip pain after surgery. And you've sent us a ton of research on this new PENG block for pain control. Gotta say, I'm pretty curious about this one.
Yeah, and it's definitely a hot topic right now. We're seeing more hip fractures and replacements than ever. So finding that balance, right, between managing pain effectively, but then also like getting people back on their feet quickly.
Oh, absolutely.
That's a tough one.
Yeah, no, you're right. Finding that sweet spot is key. And it seems like you really want to know if this PENG block is the real deal, if it lives up to the hype. So we dug into that research you sent, and honestly, some of it is pretty amazing.
What I think is so interesting here is that we're not just talking about another pain block. You know, It's like we're talking about a totally different approach.
Yeah.
It's about like working smarter, not harder, right? Like precision targeting to manage the pain, but then also keep you mobile, which is so, so important for recovery after surgery.
Huge. Huge.
Okay, so let's like break this down a little bit. You mentioned the PENG block being different from like a standard femoral nerve block, way more targeted.
Yeah.
So what's the deal with that? How is it different?
So think about it this way. Your hip joint picture like a busy intersection.
Okay.
Right. You've got all these different nerves going every which way, sending signals.
Yeah.
And what the PENG block does is it hones in on this specific group of nerves called the Pericapsular Nerve Group.
Okay.
And these are the guys that are like responsible for the majority of the pain that you feel after you've had hip surgery. So it's like shutting down the one traffic light that's causing like the biggest backup instead of just like shutting down the whole intersection.
Exactly. You got it. And the way they do it is actually really cool. They use ultrasound so they can see exactly what they're doing, and they inject a local anesthetic in a very, very precise spot.
Okay.
It's like a nerve-numbing bullseye. Right between the psoas tendon and your pubic ramus.
Hold on. Between the what and the what? Those sound like parts on a spaceship, not in my hip.
Right. Fair enough.
Yeah.
So tendons, those are like the thick ropes that connect your muscles to your bones, right? So the PENG block is targeting the space that's right next to one of those really important hip ropes, we'll call it, the psoas tendon, and near a part of your pelvic bone, which is where that pubic ramus comes in. But basically, it's all about pinpoint accuracy.
Okay. Yeah. That makes a lot more sense. So we're talking some serious like anatomical precision here.
Absolutely.
Wow. Okay. But you also mentioned it doesn't affect movement as much. Okay, come on. That sounds too good to be true. How is that even possible?
That is the really cool thing about the PENG block.
Okay.
It's designed to be what we call motor sparing.
Okay.
And what that means is that it primarily blocks those nerves, sending pain signals, your sensory nerves, while basically leaving those nerves that actually control your movement, your motor nerves alone.
So it's kind of like hitting like the mute button on the pain, but then letting those movement signals come through loud and clear?
Yes.
That's incredible.
Exactly. Because a lot of times with like a traditional nerve block, they tend to just kind of numb everything in the general area, which can leave you with like a temporarily weak leg.
Yeah.
And when you're trying to recover from hip surgery, the last thing you want is to not be able to move your leg.
Exactly. You need all the help you can get.
Exactly.
So, okay, less pain, less grogginess from heavy-duty painkillers, and like potentially getting back on your feet faster because you're not battling a numb leg too. This PENG block is already sounding kind of like a game changer. But let's be real. What did those studies you sent actually show? Like, how well does this thing work out there in the real world, you know?
Yeah, the research is... it's promising. It's actually really compelling. One study, and this is a randomized controlled trial, so that's kind of like the gold standard in research, found that patients who got the PENG block, they had way lower pain scores, significantly lower pain scores in those first 24 to 48 hours after surgery, compared to those who either got a femoral nerve block or no nerve block at all.
See, that's what I'm talking about. Those first few days after surgery are brutal. How much lower are we talking, though? Like, give me the number.
All right, get this. One study used a 10-point pain scale.
Okay, yeah.
10 being the worst pain imaginable.
Yeah.
And with the PENG block, the median pain score reduction was 7 points.
7 points? Are you serious? That's massive.
It's huge. Think about it, going from like a 7 or 8 on the pain scale down to like a 1 or a 2.
Yeah.
I mean, that kind of difference. That can seriously make or break your recovery.
No kidding. I mean, that alone would be life-changing after surgery. But were there any other, like, perks besides knocking down that pain? You bet there were. Remember how we were talking about the PENG block being motor sparing? Well, it turns out that translates to a lot more than just less pain, right?
Yeah, exactly. I mean, think about it. Less pain often means you're relying less on those heavy-duty painkillers,
Oh, totally.
especially opioids.
Yeah.
And the studies you sent, they really highlight this. People who got the PENG block, they needed way less opioid medication after surgery.
See, that right there, that's a huge win in my book. Opioid side effects are no joke. I mean, we're talking nausea, dizziness, the whole 9 yards. Not to mention, you always worry about the risk of dependence down the line.
Oh, for sure.
So dodging that bullet, major, major victory in my book.
You don't want those side effects getting in the way of your recovery, right?
Right.
Because they can. Like, if you're nauseous all the time,
Right.
it's going to be harder to get up and move around.
Exactly.
Which is, again, like we were saying, the last thing you want after hip surgery.
Right, exactly. You want to get moving.
You got to get moving. And in fact, some studies actually showed that patients with the PNG block, they tended to have better range of motion in their hip
Wow.
and were able to walk sooner.
Wait, are you serious? So not only are they in less pain, but they're also up and at 'em faster?
Yeah.
Okay, this is like the holy grail of hip surgery recovery. I'm almost afraid to ask, but there have to be some downsides, right? Like, you always tell us, look for the other side of the coin. Were there any red flags in the research? Anything that makes us want to, pump the brakes on the PNG block hype train?
Yeah. No, you're definitely right to stay critical. Like, I always say, it's important to keep a level head.
Yeah.
And to remember that every medical advancement, it comes with, its own set of caveats. So while these initial findings are super promising,
Right.
most of these studies were relatively small.
Okay.
And then they mainly focused on those short-term effects.
So what you're saying is we really need those large-scale, long-term studies to really know for sure?
Exactly. We need that more robust data, to really compare the PNG block head-to-head with other pain management options over, a longer period of time.
Right.
And in more diverse groups of patients.
Yeah, absolutely.
It's also important to keep in mind that the PNG block, it's not a magic bullet, right? It's not going to eliminate all hip pain. It primarily targets the front of the hip, but there are other nerves
Right.
and other structures back there
Yeah.
that could also be causing discomfort after surgery.
So there might be cases where people still need additional pain relief, even with the PNG block.
Yeah, exactly.
Yeah.
It's definitely a possibility. Pain is complex.
Oh, absolutely.
And everyone responds differently.
For sure.
Plus, while the PNG block, it seems to be very safe so far, we always need more research, right?
Oh, yeah.
To really fully understand any potential long-term risks or complications. Again, this is still a relatively new technique we're talking about.
Right. Exactly. It's easy to get swept up in the excitement of a potential breakthrough.
Totally.
But yeah, I think like you're saying, keeping a level head is key. That's why I love doing these deep dives with you. We really try to separate the hype from the hard facts.
Yeah, we do.
So with all that in mind, let's bring it all home for our listener, right? What's the bottom line here? What should someone who's, maybe facing hip surgery, what should they be thinking about based on all this PNB block research?
So I think the big takeaway here is that the PNG block, it's a really promising step forward in how we manage pain after hip surgery.
Mm-hmm.
I mean, the early research suggests that it could really be a game changer.
Yeah.
Potentially less pain, faster recovery, and of course fewer complications from having to rely on strong pain meds. But again, it's still relatively new.
Right.
More research is always a good thing.
Of course. So what would you say to someone who, they're gearing up for hip surgery, they're listening to this, and they're wondering if the PENG block is right for them? What should their next steps be?
Well, knowledge is power, right?
Always.
So I would say, talk to your doctor. Have a really open and honest conversation with your surgeon or anesthesiologist.
Yeah.
They're the ones who know your individual situation the best.
Right, of course.
They know your medical history, the specifics of your procedure.
Yeah.
They can tell you if the PNG block is right for you. It's becoming more common, but it's not standard everywhere yet. So they might have to specifically ask about it.
That's a great point. I think, sometimes you do have to be your own advocate when it comes to healthcare. So
Absolutely.
do your research, ask questions, explore all your options.
Exactly.
I love that. And this is where things get really interesting. I mean, as this targeted sensory sparing approach starts to catch on, it really makes you wonder, Could we apply this kind of thinking to other types of joint surgeries down the road?
Right.
Could we see PNG blocks for knees, shoulders, ankles? The possibilities, I mean, they're kind of mind-blowing. Now you're speaking my language. PNG blocks for knees, for shoulders, that'd be incredible. Imagine, like, we could target pain relief precisely in all kinds of procedures.
It's a really exciting thought.
It's like we're on the verge of a total pain management revolution, right?
Absolutely, yeah. Moving away from just masking the pain and towards something that's more targeted, more personalized, it could completely change how we think about recovering from surgery.
This is why I love these deep dives. We started with your question about like a new way to manage pain after hip surgery, and now look at us, we're talking about the future of pain management. It's amazing.
Cool, right?
It is really remarkable how one question can just like unlock so many different insights. So to everyone listening, keep those questions coming. You never know what we'll uncover together. Until next time, stay curious.